Well, hello everybody, and welcome to our LunaYou 4:30 p.m. on Thursday well-being check-ins. We're so excited that we get to do these things. The reason why we found the need to do these is because we've gotten lots of questions from the women that are in LunaYou, as well as some other just pregnant women, because we provide resources to women that just had questions about pregnancy and as that relates to COVID-19. And so we're super happy to be hosting these live wellness chats every Thursday at 4:30. My name is Courtney and I serve as a well-being coach for LunaYou. A little bit about LunaYou. We're a maternal well-being program designed for you. So really, what does that mean? LunaYou is designed around a model that has four main components. One is to help you to increase your personal power. We realize, and research tells us that, especially women of color, we have a hard time advocating for ourselves and speaking up for ourselves in pregnancy, and that leads to poor maternal outcomes. Some there's some reason why, and research is still being examined of why Black and Latino women have poor maternal outcomes, and we've looked at tons of things as it relates to income, education level, different things, but really LunaYou is designed to really help to increase the maternal outcome and to really help to give you a great personal power and to encourage you to speak up for yourself and to be your own advocate in your own pregnancy and putting yourself at the center of the pregnancy. We also are there to help to give you a circle of support of other peers that are pregnant around you through the women that are in our group. So we call it actually a circle of support, in being around you and to help you in this time and to help you in your pregnancy. Also, we help you to identify the support that you already have in your life and to really use them in effective ways to help you in your pregnancy and then postpartum. We know that a lot of the things that happen mortality wise and morbidity wise happens postpartum. And so Luna You sticks with you and your well being 3 months postpartum. So at any point where you become pregnant and 3 months postpartum to really help with your well being. All of this is coupled together with our well-being dashboard that looks at your activity level, your sleep patterns, your ability to speak up for yourself, your stress levels, all of that, which combine to give you your well-being. And we know that when you focus on a woman's well-being, that they have greater maternal health outcomes, and that's what makes it very important, and helps. Um, that's what helps in general to have better maternal health outcomes. And so we are here every Thursday at 4:30 to help women navigate through these tough times and stressful situation. So we'll have a question and answer time a little bit later in our session. And so feel free if you do have questions to filter them in our Facebook live chat. We'll be sure to check those chat. We have our staff that's on here to help you answer your questions as well, if I don't get to your question. But just want to come on here and just to address and give you some top research that we found. I also do want to pinpoint that any of the information here is not to replace any medical advice of any sort. Please see your healthcare provider for any medical information. If you are experiencing any symptoms or if you have any questions about your specific situation, please reach out to your healthcare provider. That's very important. LunaYou is not a healthcare provider. We are here to help to focus on your well being and to help provide you that personal power from within and putting you back at the center of your pregnancy. So we hope that if anything strikes you as interesting and you are currently pregnant in Rhode Island, and you're just looking for someone to care about your well being and to help to walk alongside you in these moments, that you do so that you click in the links that we have provided and you sign up for our program. We are now accepting 25 women who reside in Rhode Island and who are on Right Care. And you may have just had private insurance before, but due to coronavirus or the pandemic that is happening, you may be currently furloughed from your job, or you might have lost your job and you are in the middle of your pregnancy and you need some type of well being support. we are offering free wellness coaching for you. And so that is an awesome benefit, especially during this time. So reach out to us, sign up for this program. If you know someone that fits into this program, please sign them up. This would be a great gift for them, especially for their well-being, if somebody that cares about them, to help to get a wellness coach. So let's get started with just some cool updates and important research that we found between our last talk. Our last talk was with Giselle Bello, who is a med student at the Brown Medical School. She was amazing in helping us navigate through some of the research that we found early on as it related to COVID-19 and pregnancy. And I kind of want to reiterate some things. I found some additional resources to help us and guide our conversations today. So, according to CNN and from the American Journal of Obstetrics and Gynecology, sorry, a majority of pregnant women who are diagnosed with coronavirus don't experience more severe illnesses than the general population. So, although a lot of pregnant women have suppressed immune systems mean that you're essentially sharing your immune system between you and the baby, and so it makes you more susceptible to like different sicknesses, like colds and different things like that. However, latest research that just came out from this journal that says that women who are diagnosed don't experience more severe illnesses than the general population. So it's not like you would get the coronavirus and experience symptoms worse than a person that is not pregnant. So that's important to understand. We also found in our research that through the CDC website, and all these resources are on our website, through the website, it tells us that if you do get infected with coronavirus, that it will not transmit into your breast milk. And that in those times, if you are infected and you recently just had a baby, that wearing a mask and still breastfeeding would be safe and appropriate. Or consider expressing into a bottle and giving it to a family member to help feed the child while you are ill. So that's really important to really help to navigate through these. We are located in Rhode Island, and the primary hospital where a lot of our women give birth are Women and Infants Hospital in Rhode Island. And a lot of the women in our program have asked questions about, giving birth alone, what happens, all of that. So, according to their policy, and this is on the Women and Infants website, so right when you click on their homepage, and then they have a big banner about COVID-19, to it's right there, you can click it. And so their policy says that adult inpatients will not be allowed to visit Butler Kent or Women and Infants Hospital. That's if you're an adult inpatient. So if you're seeing like your doctor or just routine visits, a visitor is not allowed with you. However, while you're having your baby, a visitor can come with you. And I just found out too through Women and Infants Hospital that your visitor does have in and out privileges. So they don't have to stay there the complete time from your check in time to the end time. They can go in and out if you have another child, if they have a job or any other responsibilities that they need to take care of. They can come in and out. They just have to be cleared as they come in and out. So that is allowed, but you may have one, and children under the age of 18 are not allowed in the hospital during this time. So definitely want to plan ahead, all of that as you kind of navigate through that. So this is per their policy. NICU parents, I know that this was a high concern and a question that we got as well. Let's say that the baby is born and they have to go to the NICU. You will be allowed to have two designated support people during the stay. So you don't have to choose between mom or dad. You will be allowed to have two people to see the child in the NICU, which is huge and which is a great relief to parents who have children in the NICU. But definitely refer to the Women and Infants website for more information as things are constantly changing and constantly being updated. And of course, go through your medical care provider first before reaching out to the hospital because a lot of them know all of these rules, these policies that are put into place, and they can give you even more information to help you. Like I said before, we've gotten some questions about mother to child transmission and how safe that is. It says that according to the CDC website, that the mother to child transmission of coronavirus during pregnancy is unlikely. Um, in the womb, but after a birth of a newborn, they are susceptible to person spread. So just like we are susceptible to it, the newborn is susceptible. So that's why it's really important that if you or your close family members are experiencing any type of symptoms, that is alerted, that you tell your healthcare provider, and that you take the necessary precautions to prevent the spread of the disease after the baby is born between you and the newborn baby to really help you and calm your peace of mind. Um, and also, with that, a very small number of babies have been tested positive for the virus shortly after birth. So, that amount of babies who've tested positive after they were born is very, very small, according to the CDC, but there still should be necessary precautions that take place. And there has been no virus detected in amniotic fluid, breast milk, or other maternal samples, according to CDC. So, again, you can research on the CDC. They have a great page of resources for pregnant women who are expecting during these times. They update it really regularly. So it's a great resource for you to kind of reach out and to know that. And breastfeeding is still one of the great sources to protect against the disease if you're nursing. So that's just encouragement to keep breastfeeding and to keep doing that. There's great YouTube resources. Reach out to lactation coaches that are in there to really help you in this time. So some other questions that we've been getting because we know that this is some hard time, and we've had a couple of women come to us through LunaYou who have recently lost their job, and you might have had private insurance, and now your insurance is changing, or things or life has changed, and you just need a well-being coach to really help you in that time. So one of the questions we had is, I recently lost my job. Do you know of any resources available to me? Definitely try if you were recently employed and lost your job or furloughed due to coronavirus, definitely check out DTI through Rhode Island or unemployment, which is an unemployment benefit to you. The state will help with your unemployment and during this time, and you can be eligible for tons of state funded resources like SNAP benefits and different things in WIC benefits to help in this time. And so it's really important that this is affecting millions of Americans, millions of Rhode Islanders. And so don't feel down, don't feel bad. Do what you need to do to make sure that your well being is supported and that you are able to provide your basic needs. And so definitely reach out. A simple Google search with, recently unemployed, where do I go to file for those unemployment benefits if you had a job but recently let go while pregnant. Also, what resources are available to those who are quarantined within Rhode Island? A great resource, if you just Google RI Delivers, it's a comprehensive website through the state that will help to connect you to places, grocery stores, restaurants, different places that will deliver to you here in Rhode Island. It's best to get on those sites early because times fill up really fast. A part about being in LunaYou, which is really great, we help you to identify a circle of support that is there to help you. And we help you to identify specific people that can help with specific situations in specific times. And so, if one of those things, if you are feeling ill, or if you're just like, hey, I don't want to risk it while I'm pregnant, I want to protect myself and my baby, to get on RI Delivers to see if places can deliver to you. If there are no available times, to reach out to your circle of support and say, hey, I really would appreciate if you would go to the grocery store for me, as I don't want to risk it with me and my child. And your circle of support, or people you have identified as support, will be there to help you. And so in LunaYou, we work through and we talk through and identify great key people in your life that can provide support well after this program is over. And so it's important that you see this, and that you have this, so that you are able to meet your resources and your needs, and then take the precautions to protect yourself during this time. So you can definitely go to RI Delivers. So another question that we've been getting is, do I need to prepare for home birth? So the New York Times just released an amazing article. It's about, parenting and coronavirus and pregnancy questions. And they have tons of questions on there that have been very helpful as I'm learning more information about pregnancy and the coronavirus and how to really prepare. So one of the things that they have suggested into this article is, do I need to prepare for a home birth? If that was not your original plan, right now, data doesn't show us that you have to change your plans, that medical professionals have been very great in being responsive to their patients, and really navigating through the system and keeping their patients informed as much as possible, and really helping you to carry out the original plan that you already had in place. If you already had a home birth plan, that's excellent. If you're early on in your pregnancy and you don't have a plan in place, maybe consider doing a home birth, maybe consider contacting the doula for those type of services, to really help with your home birth. But right now, if you already have a plan in place, if you have your doctor in place, if you want to birth, where you want to birth, then you are able to do that. So right now, you don't have to change your birth plan. Medical professionals are really here to help, in that way. How will my prenatal care change? So this really is up to your medical, team and your doctor or your midwife, um, or your nurse practitioner that is there, to really call them. If you are experiencing any symptoms of any kind, it could be a cold, allergy symptoms. It's great to call your doctor ahead of time before you're showing up, so that they can prepare for you and that they can be ready to help serve you as best as they can. So be sure to call your provider before you show up, especially if you have symptoms. A lot of different clinics and healthcare centers have their own protocol, which they should have given you, as a patient in their system, about how to process, how to go through appointments, who can be at the appointment, if at all any. Many in Rhode Island are limiting them to just you as the patient to be at the appointments. And like I said, if you're birthing in women and infants, they'll allow you to have one other patient. So that's pretty good to know. Also, one of the things that the New York Times has suggested is having a blood pressure monitor at home. So, for the first 25 women that sign up for LunaYou, you are fitted with a Fitbit tracker that helps to track your steps and your activity levels, your sleep patterns, to really help you in your wellness. But then also a blood pressure cuff. We provide the first 25 women with a blood pressure cuff to really track these things. We know that because systems have changed, telehealth medicine has become increasingly, popular. With telehealth medicine, to really help to preserve the health of patients, that means that basic things like getting your blood pressure checked, may not happen. And blood pressure checks are a major indicator in a lot of health care risk. So, with the first 25 women that sign up for LunaYou, they get a blood pressure tracker to help track, and so that you can intervene on your behalf in your health sooner rather than later. This is very important. So, LunaYou, if you are pregnant in Rhode Island and especially are on Right Care, please sign up through the link so that we can get you connected to a Fitbit and a blood pressure cuff and really walk alongside of you and give you a well-being coach and check-ins weekly to make sure that you are where you're supposed to be. This is not the time to be lag on your health, but this is the time, and we could take this as an opportunity to help us in our health and our in provisions in our health. Um, Lastly, what can you do to help protect yourself and your family? It's always important to plan, plan, plan. When you don't plan, you plan to fail, right? You are birthing a new life, which is a special time. You are magical. What we talked about last week with Giselle Bello, you are a magical being. You are producing life, but you still need to plan for it, right? So if you have another child, to know that, like, at Women and Infants Hospital, you can't bring that child with you to the hospital. So, who in your circle of support can help to take care of your other child or children that you have at home that may not can come to the hospital? Who is that partner that is there? Who can they contact? Who can they be with? Is everybody in your family healthy and well so that they do not make the baby even more susceptible to those diseases? Who can you have if you're just stressed out? That's why it's really, really important to have a well being coach during times like this to help you navigate through lives. You can talk about anything in our well being coaching calls, from planning your birth plan to upcoming appointments, from past appointments, or just anything that you're experiencing in life that you just need coaching through and help you to identify the personal power that you have inside of you. You are absolutely magical, but the key is to be healthy, the key is to be whole, and the key is to have a plan in place for you, and to talk to your healthcare provider, your doula, all of your support team to help you when it comes time to give birth in such a time. So, definitely, if there was ever a time where our well being needed some support, now is the time for that well being. So thank you guys so much if you've joined in here. I will take any other questions that as they come, we can answer those as we get it. Um, we will answer those as we get them. Thank you guys so much. You can join us here every Thursday at 4:30. We'll have special guests. We'll have experts in the field of maternal and maternal well-being to come and talk and give their expert advice in this time about how to impact your well-being while being pregnant. We are here for you, mama. We are so happy that you are with us. We are so happy that you are a part of LunaYou. If you know a friend that could benefit from this, please sign them up or encourage them to sign up. You can find all this information and all the resources that I said in the chat feature, which is right below or to your side. Or you can find all this on our website at www.lunayou.com. At lunayou.com, you can sign up and you can register for LunaYou. You can tell a friend, or you can find all of those resources that we talked about. Until next time, friends, remember that you are magical. You are birthing magic inside of you. And this is a time you deserve to be well. You deserve to be whole. In that's not selfish. That's not anything. That's great. In that you are at the center of your own pregnancy. So thank you.